Ayurveda retains is of the idea that our bodies nourish themselves not just from the food we eat, but from 5 mouths, from 5 senses. Don't you find it's paradoxical that 3 errors are fundamental for our existence? That health is within, not without. Lifespan versus health span.
My name is Shanti, and it's my privilege this morning to welcome you and thank you all for coming for what will be a very interesting topic of interest to all of us, how to be healthy as our bodies age. And I look out through this room and I think we're all interested in that topic. In fact, I look out at this room and I'm reminded of something Satya Sai used to tell us. He would come to the podium and he would say to us, Prema Swarupa, and that's exactly what I'm seeing. Embodiments of love, every single one of you are being this morning. Thank you so much. Thank you so much. So it's my honor this morning to introduce someone who has been in Swami's fold since he took his first breath. We're privileged this morning to have his mother Sylvie with us, sitting here. And it was Sylvie who gave birth to her son Victory at the Sai General Hospital in Whitefield, delivered by our own Dr. Rajeshwari, who now has a hospital named after her. What an auspicious beginning was that. And he's been in Swami's fold since the first breath. He went through primary school, secondary school in Puttaparthi, finished his schooling until a young man, and then went to Ayurveda school in Gujarat, where he got his degree in Ayurvedic Medicine and Surgery. And since that time, has made his life helping people up and down Italy with his skills, teaching, giving help to patients, teaching Ayurveda, teaching Advaita, teaching Vedanta. And we're very blessed this morning that Swami has brought him to us to share his love and his knowledge with us. So please let us welcome Dr. Victory Foxy.
Thank you. Thank you, Shanti, for that introduction. So, I would like to begin by sharing what my approach is to Ayurveda. Ayurveda teaches us that each and every one of us is unique. The basis is the same, but our organisms are unique to each and every one of us. So that would mean putting me in a very difficult situation to be able to give general counsel, to be able to give general suggestions, or, especially when it comes to the use of herbs and medication, right? So at best, I will dedicate a portion of today starting with the basics, and then we'll get to talking about what things we can do in our daily life to maintain our balance and to maintain ourselves healthy. Yeah? Thank you. So, I think that we already started off with the most important point, and that is each and every organism is unique to itself. As we know, there are no two people who live the same experience in the same way. And this shed lights on this truth because the root of the organism is the psyche, right? It is a perfect model of the relationship between energy and matter. Matter has its roots in energy. So what are the two forms that energy takes in this organism? One is form of thought. The second is energy that is in movement. The word itself sheds light upon this truth. Motion, energy in motion, right? So these are the two primary forms of how energy expresses itself in the organism. And the basis on which it depends is what we call the tissues, is what we call the body systems, is what we call the organs, and so on and so forth. So since the root of every organism is personal, let's call it so, everything that manifests from there on forth depends on that root. And this is what gives way to a very important concept in Ayurveda, what we call as Prakriti. Prakriti literally means nature. So the nature of that body, the constitution of that body or organism. Yes? There are three physiological, let's call them pillars, that literally translate from Sanskrit into the term error. They are physiological pillars without which the organism cannot function, cannot manifest. Right? In Sanskrit we call them dosha. Dosha, the word literally means error. Don't you find it's paradoxical that three errors are fundamental for our existence? Yeah, so they are called doshas because it is through these that symptoms or symptomatology expresses itself in the body. It is through a dosha that the organism is communicating with us and shedding light upon its state, right? State of balance, so health, or state of imbalance, or the road or the way to ill health. So these three, let's call them, I call them vital principles, because it gives a better idea as to what they are movement, transformation, and stability. Movement comes first because where there is movement, life can express itself. I think we can agree on that. You take an animate object and you stop its movement, you cut out its possibility to move and you make it inanimate. We can't say it's living anymore, can we? So that's the idea. Movement comes first, followed by the capacity of the organism to transform. Transform what? Everything that it receives. Ayurveda is of the idea that our bodies nourish themselves not just from the food we eat, but from 5 mouths, from 5 senses. Everything we can listen to, we touch, we see, we taste, we smell, has in some way or the other some capacity of nourishment for this body. So if you see it from that perspective, everything that the body receives has to be processed by the body. Our daily experiences or the life that we go through, our body processes this through the subconscious while we are sleeping. Dreams are the result of that digestive process in the subtle. On the physical level, we have the digestive system, and so on and so forth. So there are various processes that happen within the organism with only one intention: to transform whatever comes in, whether it is in the form of a sensorial perception and so energy, or it is in the form of matter, so food. The body has to break it down, has to take what is useful for it and then create what we call the waste material. Right? Thirdly, we have the principle of stability. The principle of stability is what gives strength to the body, renders stable, renders strong, and maintains the body in health in time, or at least gives the capacity to the body to maintain itself in time. Because it's important to understand one very sometimes missed truth, that health is within, not without. Health is that capacity of the body to maintain itself in balance while we are experiencing everything that we do in life, right? So let's just break down right at the start the one pill myth doesn't exist. Technically, yes, we use pills in Ayurveda as well, but the intent is different. The symptomatic approach, and by this I mean curing symptoms, we do in Ayurveda as well. But it's not the first priority, right? Considering what a deep vision Ayurveda gives us, as a consequence, we can see where the root problem lies, and we tend to want to go there. We tend to want to be able to eradicate the problem, right? Okay, so these doshas, usually when we talk about them, movement, transformation, stability, they are usually spoken of when we're talking about the body physically, right? But they have certain subtle expressions as well. The subtle expression of movement would be what we call prana, the vital energy that we intake every time we breathe. What is the role of this prana? We call it the vital sheath, the vital energy for this reason, because it's vital for for us to continue living this life's experience. So what does this prana do? The direction it has is from the head to the toes, and then it goes back to Mother Earth, and she, let's call it, recycles it into the elements, into the oxygen around us, and then we again receive it. What impedes the contact between prana and our cells is our mental state. That's what Swami means when he says the mind, breathing is necessary first for the mind, then for the body. He has said this many times. Through breath work, we can calm ourselves when agitated. Through breath work, we can activate the energy in the body when feeling lazy. So it's always, the root is always there again, I repeat. So prana is the subtle expression of the principle of movement. Then we have the principle of transformation. Its subtle expression would manifest in terms of clarity, in terms of detachment, in terms of the capacity to manifest your desires, your thoughts, what you want to create in the world. With utmost clarity, if someone is clear of what they want, it means their their principle of transformation in the subtle level, in the psychic level, is clean, is clear. It's as Jesus said, right? Don't be like lukewarm water. Be either cold or hot. If you're lukewarm, I can't use you. So that's the idea, right? So, third aspect, when it comes to the principle of stability, it manifests in the subtle in the form of what we call, what is akin to the immunity in us. The immune system in the body is compared to what we call ojas in Sanskrit. And it is what maintains the body in time healthy. It is what maintains the entire network of channels in the body clean, so that the body can continue processing information from the outside. So in this sense, the body is nothing else but a processor of information. Subtle information, so this means all the exchanges we may have with the outside, listen to someone speaking, watch something, watch a video, listen to some music, it's all energy that has to be processed by this body. Right? And then physically, we're talking about the food we eat. The key line I always use when I introduce Ayurveda is, too much of anything is not good. That's why I try to keep my consultation short. So, being a processor of information, this body has to have the capacity to do so at its best. Okay? We live in duality, correct? So till now I spoke about these doshas in a positive way. That's one side of the coin. What's the other side? The other side of the coin is when they start expressing their imbalance. When they start saying, look here, something is up, listen to me, try to decipher what I'm telling you. Right? I always say the body always speaks to us, but we just have to learn how to listen to it. Right? So we have this digestive capacity which is fundamental. In the body, the most important expression of this digestive capacity is in the stomach, in the gastrum, that area of the body that we call the solar plexus. Why is it called the solar plexus? Because it is the hottest part of the body, and it emulates the sun on the outside. In fact, our digestive capacity during the day follows the sun. We have heard this adage, right? Have breakfast like a king, lunch like a prince, and dinner like a beggar. Why? Because physiologically, the digestive capacity follows the sun. So when the sun sets, if I have a last meal to eat, it should be light. It should be light, simply because the sun here emulates the sun there. Okay? When I introduce Ayurveda, and this part is not something that I read in books or in texts, but it's something that came to me during, clinical work. This, let's call it a model, the way I introduce the three most important aspects of the body, of the organism actually. I keep calling it organism because I think this organism is a mix of more bodies. Again, this is my part of the introduction. It's not derived from, straight from the texts. So I think it's important that I mention that. We have the physical body, we have the emotional body, and we have the psychic body, right? By psychic body, I mean everything pertaining to thoughts, everything pertaining to the conscious, subconscious, unconscious. Then when it comes to the emotional body, everything that is pertaining to what I feel, my emotional states, everything that I perceive on the outside, what does it do to me as a consequence? And lastly, the physical body is what we see. So if we follow this model, we can see an organism, as I was saying, which is a perfect example of the relationship between energy and matter, is 1/3 matter, 2/3 energy. So majority of the body you can't see. Majority of the body you can't quantify. All that you're trying to quantify, and we can quantify, pertains to the physical. Of course, also microscopically speaking also. Physical, but still it's physical. There's so much that we can't see, there's so much that we can't quantify. This is very important. So when I talk about the body's nature, what do I refer to? On the one hand, I refer to the physical aspect, the integrity of the organs, the integrity of each tissue. From an Ayurvedic perspective, we are explained and we are told that every organ pertains from one of these tissues, is made of these tissues. So how strong are these tissues will determine in time which is weaker or remains strong, right? Let's say these tissues are like this bracelet you see over here, right? Every chain in existence has the weakest link. We agree, right? Every chain has a weak link. With the same analogy, we can understand the tissues in the body. It's like a chain of tissues. And each body has its tissue which tends to weaken faster rather than the others. And this, if we go back step by step, depends on other factors, depends on energy states, depends on emotional states, depends on dosha states, depends on the state of these vital principles, as I've been calling them, right? The second part of what I mean when I say body constitution or body nature is the character of the individual, right? And what is encompassed in character is also life habits. What habits do I have? What food habits do I have? What thought process habits do I have? In what situations tend to make me become reactive? What situations tend to calm me? All of these aspects are individual. Okay? Okay. And the state of this nature of our organism depends on genetic and epigenetic factors. By genetic factors, we mean on a cellular level what our generations give to us. Epigenetic factors is related to what the surrounding ambience in which we live, and this includes the people with whom we live, what all of that gives to us, right? There are many health problems which are related to epigenetics more than genetics. Because epigenetics is related to energy fields which are invisible to the naked eye. And in time, those energy fields which have a certain vibration, if not pro-health, but against, which are not conducive to health, in time, these energy fields have the capability of, on the one hand, forming the individual or the individual's character or habits, and on the other hand, potentially also disturbing the organism. That can happen. And the long-term effect of this is the modification of what I am calling matter in the body. The tissues, the organs, the organ systems. So we were talking about genetic and epigenetic factors, yes? This brings me to the next important point. I have listed out the points because being such a vast subject, there is always a risk to go elsewhere. So let me just stick to the topic. Aging is a natural process, right? When people ask me to talk from an Ayurvedic perspective about longevity, what is Ayurveda's perspective of this? Lifespan versus health span. Lifespan, I repeat, versus health span. This doesn't mean that certain body difficulties and symptoms don't have to be present. They can be present. But how am I dealing with them? How do I deal with my situation? That's the first step. First, most important step is acceptance. To be able to become objective enough and try to understand what the body is telling us. That's the first step, right? Our choices and actions determine the quality and speed of aging. I repeat, our choices and actions determine the quality and speed of aging. Both when I am referring to lifespan as well as health span. Because when I'm referring to health span, I think I've already explained quite a few points which make it quite clear when it comes to our day-to-day lives. When I'm referring to health span, lifespan, yeah. That is in relation to my breath work. We know, yoga has told us this. Yoga tells us that every person, the moment they're born, they have a set number of breathe in, breathe out, breathe in, breathe out. So over a span of a lifetime, the more time you spend angry, reactive, in agitation, you're shortening your time here. The more you remain in balance, you're giving yourself a few more moments. Okay? So there are a few points that the ancient texts explain when it comes to maintaining the health status or losing the health status, right? The first is, I forget the Sanskrit terminology, apologies in this moment, but the first is in relation to the I in us, the little I, what we call the false I, right? In the Charaka Samhita, it's very plainly explained that the root of all malady is there. What does this mean? Does it mean that we were born with a problem? No. The misuse of that I can lead to issues. But the misuse of that I can lead to issues which don't always manifest in that lifetime. It can manifest in other lives as well, right? Let's keep that in mind. But here, day to day, today, what use can I make of this knowledge? The misuse of the 5 sense organs. As I said before, too much of anything is unhealthy. So that pertains also to how I am using my sense organs. Am I listening to too much music or too loud music? Am I watching too many things? Right? Am I eating too much or too little? So either way, if it's too much or too little, it's not good for the body. The body needs its balance. You see, because these 3 doshas that I was referring to before can be likened to 3 waves, energy waves. Up and down, up and down, up and down. And when they are normal, they express physiological, let's say, things pertaining to the body. I'm hungry, I'm full, I'm sleepy, I'm rested, I'm angry, I'm peaceful. All these things are expressed through these doshas. When they, like waves, go through their ups and downs, ups and downs, ups and downs. Their ups and downs depend on the relationship with the outside. So see how we are very intimately connected to the world, right? Each and every person in this room is extremely fortunate for where we are. Extremely fortunate. For all the reasons that I mentioned till now. Energy fields, thought process, reactivity or not, breath work, daily habits, everything is conducive to health the way we live over here, right? Another aspect that can cause premature aging, another aspect that can cause premature aging is what we call as kala parinama. Kala parinama, so untimely things that may happen. So when something is untimely, we can see that, we have seen that of late. Now maybe it's a little better, but at least for the last decade, we have seen how the seasons have modified themselves. A lot. So when the seasons get modified untimely, they cause health problems. So that's one example of kala parinama. Another example of kala parinama is when there is untimely use of our sense organs. That's also, connected to kala parinama. Stay awake too late, don't sleep in the correct hours, right? So on and so forth. Eating not in the right timing, eating even though I'm not hungry. All these are examples of kala parinama. These are things that lead to potentially 1 or 2 things, pain and or suffering. I wanted to put this point in because it's very important to understand the difference between the two. Pain pertains to the body, suffering pertains to the mind. And as Swami has already told us, there are times you can't choose when it comes to pain. But suffering is always a choice. Very important. Suffering is always a choice. Pain, maybe not. Obviously, if I bang my leg against the door, I feel the pain. Right? Action, reaction. So there are few let's say, suggestions that I was thinking of sharing today when it comes to living our lives in a healthy manner. I repeat what I said in the beginning. I won't go and talk about specific medications or herbs, etc., because I'm of the idea that I need to know the person before being able to give any advice. But there are general, habits or things that we can inculcate in our lives daily. First, conscious eating. Conscious eating. There are various studies that show that while we are eating, if we go through a trauma, it may be something we have seen, it may be somebody shouting at us, the mind associates that food item with that experience. And in time, what it does, it creates potentially a wrong relationship between the body and that food item. And then we start getting what we call as allergies or intolerances. But the root many times, I'm not saying it's always like that, but many times it's like that. Of course, food intolerances and allergies can be born also of abuse when you're eating not in the right manner. There are many reasons for that to happen. But I was just making the connection between conscious eating, so the psyche and the food we eat, right? Utmost importance to be there when you're eating. Just bring all the attention over there. While we live in a world out there in what I call the minefield that is used to watching a screen while eating. The thing is, most of the times while we are eating, we are watching news about wars and about poverty and about violence. That is food for the body. That nourishes the body even more, whether in a good way or a bad way, than what we are putting in our mouth, right? So conscious eating. Second aspect, sleep. When it comes to sleep, there is a relationship between these, what I was calling the vital principles, not the doshas, principle of movement, transformation and stability. They have a relationship with time. And in the ancient texts, they describe in detail, and one aspect is related to the hours of the day. From an Ayurvedic perspective, the hours which give us most rest are between 10 p.m. and 2 a.m. Okay? If we go to bed later than that, we are eating away rest for this body. Or at least, let's call it prime rest for the body. With patients out in the world, I try to limit them to maximum 11 p.m. I tell them, don't go beyond 11 p.m. At least do that, because if I say 10 p.m., they'll be like, bye-bye. It's too early, maybe, I don't know, for many. So, in the habit of going to sleep in the right hours, right? And then in the morning, to maintain the health, I won't go into the specific reasons right now, but if we have time, maybe later we can, if there are questions pertaining to this. It would be best to wake up either within the hour before sunrise or within the hour after sunrise. Technically about 40 minutes to 1 hour, either before or after. In the technical term in Sanskrit would be muhurta, no? We say muhurta. Simply because when we follow this advice, the energy that the body has to face the rest of the day is at its top. If we wake up too late, we become like, pardon me, but this analogy comes to mind, like diesel engines, no? Diesel engines take time to warm up. And the energy is not the right energy. We're too heavy, let's say bogged down. Thirdly, the concept of dinacharya. Dinacharya means daily routine. Daily routine. What is part of my daily routine, and is it the same from day to day? This discipline, no? Swami said discipline is fundamental. Discipline is very important for health, not just for our mental state or spiritual progress. Also because we need health for our spiritual progress. So our daily discipline is related already to two things that I said, right? Conscious eating and proper sleep habits. There are a series of cleansing practices that Ayurveda mentions, which we won't go into today, but maybe in the future, if it is of interest, we can talk about it. That Ayurveda suggests we do every morning, fundamentally to give energy to the body and to keep the sense organs clean. Our entire experience, that is life, depends on our sense organs. I think we can agree on that. No, everything that we experience is through our senses. In time, there is, let's call it, wear and tear of the organs themselves. And so it's important to, through these practices, give some support to the body in keeping these senses sharp, in keeping these senses strong, functionally and also physically. In relation to this, there is also the suggestion of daily oleation, what we call snehana in Sanskrit. Through the use or application of tila, sesame oil on the body, if not daily, if we can't do it daily, maybe, unforeseen circumstances, etc. At least I am of the idea personally that minimum 3 times a week. Apply this oil on the entire body and then go and have a shower. The oil has to be slightly warm, obviously, not cold. And while you do it, avoid being in a cold room. And you just apply this body. It's just barely 300 seconds are enough for the tissues to take exactly what they need. Right? So you 5 minutes, 300 seconds is 5 minutes. Just 5 minutes, more than enough. The body will take exactly what it needs, and whatever remaining oil is, then it will remain on the skin. But why is this important? Because oils, especially sesame oil, chemically is very close to the chemical structure of the skin. And when it is warmed up, the oil, the body has a very high capacity of absorption of this oil. And the oil confers strength, it confers stability, it confers energy in time. Because when we age, the tissues dry up. Physiologically also, the tissues dry up. It's not pathological or a malady. Physiologically, our hair becomes whiter, mine a little too early. Our skin dries up, and then the muscles lose their laxity, etc., etc. So physiologically, there are many things that are happening which pertain to fundamentally dryness in the body. One could tell me, okay, fine, then I'll use water. No, water dries. Have you ever washed your hands more than once in a day? 3, 4, 8 times a day? You end up with 2 hands that are extremely dry. Oil is necessary. Right? It's like oiling a car. Well, I did mention it here, but I don't have to go into detail. The importance of meditation and mindfulness, we all know that here. There is another point mentioned in the text, sadvritta. Sadvritta means a moral lifestyle. A moral lifestyle, extremely important, because as I was saying earlier, the root of, the ancient texts mention that the root of health problems is the false I, right? Ahankara, as I mentioned in the beginning. But ahankara has its uses, otherwise we couldn't. Again, delaying, let's say, the aging process of the tissues, right? But then here, actually, all that I spoke of is in relation to rasa.
But of course, usually when we talk about Rasayana and Ayurveda, we think about certain herbs, certain products, certain formulations, etc. But as I mentioned, I'm a bit hesitant of giving general instructions, because I've seen that it doesn't work for everybody. What works for one may not work for the other. Right? What else? I'm just thinking if I'm missing something before we can start with the questions. So when it comes to food habits, one last thing. When it comes to food habits, when we are in a state of balance, when we are healthy, one must follow what Mother Nature gives us seasonally. Seasonally, what fruit is she giving us? What vegetables is she giving us? Because Mother Nature knows exactly what's going on in here. Seasonally. In every season, the physiology within us responds. Responds to the winter, responds to the summer, responds to the wind, right? Responds to water. So, because this organism is a makeup of the same 5 elements which are out there, right? So if we follow our diet seasonally, it is pro-health, let's put it that way. But there where there is an imbalance, usually suggestions are given by the Ayurvedic doctor for that person. Right? Avoid this food item, avoid that food item, avoid eating this at night, or have a heavier breakfast, so on and so forth. It depends for each person. Right? I could have come here and sat here and said one word, which is depends. But because that's the idea. That's very core to Ayurveda. Very core to Ayurveda. You can't put everybody on the same plane. It's not possible. And with this, let's give space to the interaction. Thank you.
Sorry, no walking away because I want to change you, but because my question is, after to tell to them, is possible to continue with online, with all registration for me to be, you are leaving, no, and next time we don't know when you come back, with things we enjoy. Thank you, sir.
Thank you.
Could you repeat?
Yeah, he was saying, he said he apologized because he has to leave for Seva, and he was suggesting and asking if we could continue such meets, if not here, online as well. So, let's see.
You said that every disease is caused due to the imbalance of the 3 doshas, Vata, Pitta and Kapha. So is it possible to identify which dosha is predominant for a particular disease and how to bring the balance back? Does Ayurveda suggest any method? For example, in most of the allopathic treatments or the diagnosis, they don't go to the root level of these doshas and all, they just symptomatically they treat. So whether Ayurveda has got, for example, diabetes. So what dosha is imbalanced in the dosha? Which dosha is predominant in diabetes? Can Ayurveda, as Ayurveda investigated and found out which is the dosha which is predominant in different diseases, and what is the cure for each?
Absolutely. Thank you for the question. So, absolutely, part of the diagnostic process in Ayurveda, actually the central part is the state of the doshas. That's one aspect. The second aspect is the state of each dosha, what it has done to the tissues in time. So the state of the tissues also we have to understand. Each pathology or disease in Ayurveda can pertain to either of the 3 doshas. When you talk about diabetes, there is the Vata type diabetes, Pitta type diabetes, Kapha type diabetes. Right? But fundamentally, the principle in diabetes is what? The incapacity of the body to process liquids. Fundamentally, if you go down to the basic point, it's related to liquids. But how is that being expressed in the body? If it's being expressed through Pitta, I have to cure Pitta. I can't cure Kapha. Because liquids are related to Kapha, which is the third principle of stability, as I was talking about. Right? So it depends there also. I have to say it depends. The doctor will know how to intervene and help. You see, as I was saying in the beginning, the symptomatic approach exists in Ayurveda also. But we tie it down with trying to deal with the root problem. And dealing with the root problem comes through diet suggestions, comes through lifestyle suggestions. So it's like, Ayurveda is science that is centered on the person, not on the problem. This is very important. This is fundamentally important, especially if you see, I hope I have answered your question because I'm continuing now on another point which is related to your question. If we look at it from the point of view of quantum physics, that which you give attention to, you nourish. So Ayurveda being, or any science that is centered on the person, works long term. Right? Symptomatic approach may be used if there are symptoms which are disturbing you, but 360-degree treatment has to be followed. Doctor's consultation is needed. Yes. Yes. Depends. There are doctors who use Nadi Pariksha, the pulse reading, and there are doctors who don't. Depends. I know a doctor here whom I usually take devotees in Chikbalapur who is very good. He does Nadi Pariksha. He's good. If you want, I'll give you his details.
Sir, you told to use the same oil for body massage. Even coconut oil also work? Because I was using right from childhood coconut oil, so I would like to know.
So, yes, of course, coconut oil also is suggested, but you see, coconut oil compared to sesame oil is in property, it's very cold. Okay, so it confers strength to the body, it does, maybe even more than sesame oil, but I usually go with the basic oil, which is sesame oil, because the text mentions so. When they talk about the different oils, they say sesame oil is the best. And then they talk about coconut oil also. But there the applicability is reduced. That's one point as an answer to your question. Second point, if you are habituated to doing that, you should continue. It's very important because your body has got used to that healthy process or healthy habit. So you should continue.
And olive oil, excuse me. Olive oil.
Okay, so what's the question?
Same question, yeah.
Yeah, again, olive oil compared to coconut oil. Olive oil has a tendency to clog more than other oils. So I wouldn't use it. I've used it to test it therapeutically, but I wouldn't use it, yes.
Small question. Whether I have to think always I am becoming bored or to ignore it. To move forward. That is my question.
The question was, what must I do with the constant thought that I'm growing old? The way I see it, our thoughts many times have roots that we don't see. So many times we can't control where they come from or what the mind is telling us. What's more important is what we do in the presence of those thoughts. Right? The idea is to bring your attention elsewhere. The easiest way to do this is to be now and be here. If the thought is there, let it be there. Don't push it away, because if you push it away, it becomes, we give it energy. Let it be there. As long as we bring our attention elsewhere, like as I was saying, try to bring attention to what you're perceiving. You're feeling hot, you're feeling cold, you are, while you're washing the dishes, you feel the water on your hands. Just use the senses as an anchor to bring the mind down there. That's a suggestion that comes to mind. Simon.
What is the role of mantras, chanting of names in curing diseases? Because it is highly advocated not only for spiritual advancement but also for physical betterment.
So we have the concept of, actually Ayurveda talks about various forms of treatment, amongst which we have Daiva Vyapashraya, which pertains to the treatment through spirituality, treatment through rituals, treatment through devotion and respect to the divinity. While we study Ayurveda, we are taught to look for causes firstly on a physical level. If you don't find anything there, move one step up, psychological level. If you don't find anything there, pertain it to karma, right? So usually the solution for a health problem which is pertaining to one's karma, and so the cause is not present in that moment, usually Daiva Vyapashraya is suggested. Usually, as I was saying, prayers, mantras and all are suggested. To pray to our ancestors, to pray to God to help us in our karma, right? But technically mantra we say, it's an instrument for the mind. Earlier I was talking about how this organism is a perfect model of a relationship between energy and matter, correct? And I also said that energy has two forms, thought form and emotion form within us, right? So at the root of this organism, if I have a mind which is unstable and goes all over the place, it robs energy from the body. It robs energy from the body. It's like if I go through an extremely stressful day, I'll be different when my head hits the pillow that night compared to a non-stressful day, right? So I think that answers the question. That's the importance. That's the importance of mantra, because mantra will make the energy in the body linear. And when that is there, it won't rob first off the energy from the rest of the body, from its digestive process and everything else. And so the tissues will be better nourished long term. Sarah.
My question is regarding sleep.
Yes.
I had a disturbed sleep in the night due to something. I had undergone operations during the course of the operation testing period. My sleep is disturbed in the night.
No, it's normal. Yes. So the question is on sleep, and the gentleman said that he had a series of operations, and during the recovery period his sleep was disturbed, and if that can be compensated during the day. So short answer would be yes. In such case, yes, it can be compensated. Normally, when it comes to sleep, on the outside of that situation, normally when it comes to sleep, day sleep is prohibited, because on the long run it slows down the metabolism. But it's allowed for children, for people who do extremely strenuous work during the day, physical work, and for the aged. These are what's the term I'm looking for? These are the exceptions. Thank you. Who said that? Thank you. Exceptions. Normally not allowed. 10 minutes you lie down, relax after lunch, okay. But not more than that. Normally.
So for the age, we know what is the ideal for aging, how much you can sleep every day?
It depends on how much you're sleeping at night and how well you're sleeping at night. You see? So we know that after a certain age, the hours of rest that you have are lesser. I mean, even physiologically, you don't need that much, right? Around 6 hours, let's say, more or less. But if you wake up and your sleep is disturbed and you feel tired, you're unrested, about half an hour in the afternoon is fine.
You've kindly showed that you've worked on yourself a lot. You've used yourself as an experiment for different oils and different Ayurvedic techniques and all that stuff. So the body that we have, all the bodies that we have now, they're a function of all of these past lifetimes. You've mentioned that, right? Okay. And the physical body is only a third, potentially. Okay.
I don't know what aspect of which life is manifesting here.
That'd be nice to know, but you must have done some research, because you have these Dr. Spock ears, okay? And I want to know if you have examined that and see what influences that has had on this profound knowledge that you have now. Does this come from another solar system, another incarnation? Do you know?
Thank you for the question. No, I have no idea. All I know is that Swami had always said that I'd be a doctor. That's all I know. When he named me, he said I'll be a physician. That's all I know.
What age was that?
I was, 3 months old? In the womb. Okay. I stand corrected.
We learn new things every time.
As we get older, then we sleep less. And what happens if one is sleeping more?
Everything slows down metabolically. Right?
It's a imbalance.
Exactly. The paradox is, the steps are these. You oversleep, you over-rest, laziness sets in, because that is tamas. Tamas is directly related to kapha. There's a direct relation. So tamas, as an energy field, modifies the tissues through the slowing down of the metabolism. And when there's too much kapha, one is weak. It creates weakness. It creates weakness in the, let's call it fight and flight response, weakness in the immunity. Okay.
So what do you do with the kapha imbalance?
What do I do with the kapha imbalance? Depends. What do I do with the kapha imbalance? So when we talk about kapha, which is the last, as I was calling it, vital principle, which is stability. Before, when I spoke about them, I spoke about how there are two sides of the same coin, right? They have the healthy aspect and the non-healthy aspect. The non-healthy aspect of the principle of stability is there where there is too much stability. There is too much lack of movement. Right? So what do I do with that? I start trying to see how to activate myself. And the root of that is tamasic thoughts. Clear?
So as we get older, vata becomes more predominant?
Physiologically, yes. Physiologically speaking, as we get older, vata is, let's say, predominant, yes.
And what does that mean?
That means the thinning down of the body, the thinning down of the tissues, thinning down of, when it comes to the physiological processes, when it comes to the way we experience hunger or we feel hunger, everything becomes irregular. It's not stable anymore, right? You see, we are warm-blooded animals. So fundamentally, our body depends on fire to function, on heat to function. So where there the heat is stable in the body, the Agni, we say Agni. Where the Agni is strong and stable in the body, all the physiological processes carry themselves forward in a stable way. If there is too much kapha, these physiological processes slow down. If there is too much of vata, they become irregular, erratic. The most common symptom of this is the inability to finish reading a book, the inability to be disciplined in one's daily life, the inability to stay the path. And physiologically, this can manifest in the form of irregular digestion. Sometimes I'm hungry, sometimes I'm not, sometimes I digest, sometimes I'm not, etc.
So we lack the concentration in the vata.
Oh yes, absolutely. Absolutely. On a psychological level, these three doshas also manifest through the Mahagunas, what we call Sattva, Rajas and Tamas. Through them, these doshas manifest. You can be agitated, you can be confused, you can lack clarity. This is when Vata is too much, right? And as a sideline, it has an effect on everything else in the body. It has an effect on everything else in the body. I'll give all of you my example, my current example. My current example is, due to my work routine in Italy, my Vata has shot up. I went to see the doctor because Ayurveda teaches us that you cannot you can't give yourself a diagnosis. You can cure yourself, you can help yourself, but you can't diagnose a problem for yourself. You don't have the objectivity. So I always first of all find the proper doctor and go to that doctor, right? Even though I am a doctor. So Vata is shot up. Why? Because of traveling. As a consequence, it has modified my digestive capacity. I'm not digesting the way I used to. It's all connected. It's all connected. He gave me something for, to help calm the mind. He gave something to help kindle the fire. Two things together. You have another question?
Yeah, we're all born with three doshas.
Yes.
Right? And then what you address is the imbalances when they go out of whack in Ayurveda. Is that correct?
So the question is, we are all born with the three doshas, and we basically, when there is a doshic imbalance, that's when we go and correct it. Correct. Absolutely. Because as I was saying, I use this analogy. I can't draw it for you. Actually, I can. One second. These two lines that you see, the straight lines up and below, are, let's call it the limit for the wave you see within. The wave is the expression of the dosha on an energetical level. Energy is waves, right? We know that. Energy, sound, energy travels in waves. Right? So the dosha also, when it's expressing itself physiologically, let's take, for example, the heat in the body, right? Which is related to Agni, which is related to the principle of transformation in the body, right? So if it's up here, I feel hot, I undress, or I look for the AC, or I put on the fan. If it's the opposite, if it's less, I start feeling cold, I cover up. So that's the idea. So this wave is one dosha. I'd have to add two more waves. Right? So let's add two more waves. All of them are respecting the limits, upper and lower limit. What do I mean by these limits? These limits are what determine the expression of the dosha. If the dosha is within this limit, which is personal to every body, to every organism, then they are in a state of health. If a dosha does this, starts going beyond the physiological limit for that body, every time it does so, it expresses a symptom. Because it's telling us where the problem lies. We just have to learn to understand its language and learn to listen. That's it.
I experienced lately in the last 2 years that I become so much more sensitive to the heat, to the sun, to the light. I was living in the tropics, working in the tropics, and it was not a problem. But right now I want to close the curtains and keep the sun out, and body feels very uncomfortable.
So when there is a Vata imbalance, all of us know what is Vata here, no? The principle of movement I was talking about before. So when there is a Vata imbalance, any small change on the outside will cause disturbance. Any small change. So thermoregulations, as she was talking about, also the perception of light, and then you lose the capacity to sustain extreme temperatures. You suffer the cold very much as you suffer the heat. Why? Because Vata is off balance. So fundamentally it's a Vata problem. Currently, no. Currently, I'm leaving tomorrow. I don't live here.
So, if Vata increase, that means travel sickness will be available there. What do you advise to decrease Vata when travel kidneys will stuck us?
I'm looking for gentle suggestions I can give. You need a consultation, that would be best. If you get a consultation, the doctor will be able to understand where the Vata is blocked in the body. Because it's not as simple as saying Vata imbalance, you see, because Vata imbalance can be anywhere. It's up to the doctor to be able to decipher how to, let's say, open the gates to that Vata that's blocked, so it'll, again get back to its place.
Why some people have travel sickness and some people no?
In relation to some trauma they must have gone through, could be in relation to the relationship that their body has with Akash. Akash is the first element, what we call as space, right? I was mentioning earlier how this organism is nothing else but an expression of these 5 elements, right? The world outside is made of these 5 elements, right? So microcosm, microcosm. When it comes to moving in space, you have Vata, okay? You have the first dosha, the principle of movement, which is off. But it may be so deeply entrenched that you can't take it away from the person. It depends also there. You have to see, you have to try to understand. You can try to maybe lessen the symptoms a little bit and help. But fundamentally, it is in relation to the space element in the body. I don't know if I have answered your question. Have I answered your question? No. It depends actually. It depends on various factors. I try to explain them now also.
What's the difference between doshas and gunas?
As I was saying, when we talk about doshas, we primarily are referring to the physiological processes and the body, the physical aspect. Gunas are more in relation to energy fields. You see, in yoga, when we talk about gunas, we tend to just tie it down or tie down the concept to the mind of the person. But the Mother Nature depends on gunas to function. So that's one point. Secondly, amongst the 3 gunas, the ancient Ayurvedic texts mention that 2 of them can be called doshas, because 2 of them can create imbalance. The 2 are Rajas and Tamas. Sattva cannot create imbalance. Sattva always brings back to a state of balance. Rajas and Tamas can create balance, because Rajas creates too much movement or, agitation, or Tamas slows down and, renders lazy.
What is the recommended relationship with an Ayurvedic doctor? I'm speaking from what I know of Chinese medicine, and that you go on a regular basis to see the doctor frequently, once every 2 or 3 weeks, in order to maintain preventive care. And usually in allopathic, you go when you're already sick. So what's the recommendation with an Ayurvedic doctor?
Yeah, Ayurveda's, amongst its main strengths, is also prevention. Because majority of its wisdom is related to how we must live our lives. So through a doctor's consultation, who accompanies you in time, we can obtain the correct habits, right? So that's the idea. When it comes to Ayurveda as well, each doctor decides with what frequency to see the patient, but usually, in the beginning at least, in the beginning, if the patient, I can talk for myself, in the beginning when the patient comes to me with a problem, in the beginning I see them every 2 months. which already is a lot compared to modern doctors in Italy. I see them every 2 months, and then depending on how the progress of the cure is going along, I see them lesser and lesser and lesser. So there are many patients who come to me twice a year just for a checkup. And if there is some issue, I give them so that, we maintain their state of health.
Simon, it is my privilege on behalf of all of us to express our deep gratitude to Swami for allowing us to meet here together, for sending us such a wonderful instrument with so much of inspiration for how to live our life. I cannot summarize or highlight anything, it would be futile. The only thing which I feel I can even more appreciate the Mahavakyas which we are receiving from our Sadhguru and Swami in all forms, which is the general cure. And you so wonderfully, implicitly highlighted it. Sai Ram, and thank you very much.
Samasta